Hi everyone, and welcome back to World Food Safety Day live chat. Our next speaker is Lydia Buchtmann. Lydia has a Master's in Communication by Research from the University of Canberra and a Bachelor of Arts Honours degree in Anthropology from ANU. Lydia is a Canberra-based communications consultant specialising in risk and crisis communication. She worked for the Australian, New Zealand, Food Standards Australia New Zealand from 1997 to 2010. And she worked on complex issues such as consumer concerns about chemicals in food and genetically modified foods, as well as major food emergencies. Everyone would remember the melamine milk contamination in China. She established and chaired the Government Food Communicators Group in Australia and New Zealand, and was a member of a group linking communications experts from Australia, New Zealand, the US and Canada. Lydia now provides pro bono communication work for the health promotion charity Food Safety Information Council and is a director of their board. EHA has great pleasure to maintain our relationship with the council, and it gives me great pleasure to hand over to Lydia for her presentation on food safety in Australia and New Zealand. Welcome, Lydia.
Thanks, Phil, and thanks for the opportunity to do this. So, so this afternoon, hopefully we get the presentation there. Yeah, there we go. Just want to talk about food safety and the whole of the food chain. I think with the introduction from the US this morning from James, it was very important to point out that, food safety really is everyone's responsibility. So, so this is basically what we'll cover in the next slide. So this is a personal view of communication. I'm not a government representative anymore, but certainly I've been involved for almost 25 years in the whole food standards issues in Australia and New Zealand. I'll give you a bit of food regulation history for both countries, outline of the code, and then how risk analysis works, what works well within the system, what works less well, and the role of community and education campaigns in all of this work. So on to the next one. So here's Australia and New Zealand, and not to scale, I may say. Look, food is very important to us. I notice in the US they import a lot of their food. In Australia, it's very much the other way around. Food commodities are the second most important export in Australia after the mining industry, and the first most important in New Zealand. So a very important thing to do. So, and to keep our food safe. Otherwise, it really does wreck the economy. So on to the next slide. Now, obviously, in Australia and New Zealand, the traditional methods of the First Nations, and may I pass on our respects to the First Nations of Australia and New Zealand, but the traditional food safety methods were excellent until Europeans turned up and sort of muddied water holes and put hoofed animals all over people's crops, and it didn't work very well at all. In the 19th century, the original colonies of Australia and New Zealand had their own food safety laws by the middle of the 19th century. A lot of those were about contamination of food or keeping water safe, or big emphasis on beer for some reason. That seemed to stick right through the 19th century. 20th century, we got onto newer types of, the origins of environmental health and things like milk pasteurisation, which saved a lot of lives, and proper drinking water everywhere. But slowly the Australian states and territories of New Zealand were all developing different laws which were hampering trade even across states, so it's getting very inconvenient. So by the 50s, there was a push to have uniform food and drug regulation. 1991, it was the National Food Authority. By 1996, New Zealand joined the process, and we became the Australian New Zealand Food Authority. The Joint Food Standards Code for both countries came in 2000, and in 2002, the name was changed to Food Standards Australia New Zealand. Hate to use the acronym of FSANZ, but that tends to be what's used. I had a journalist friend that said it sounds like a sneeze once. So here we are, the Food Standards Code as the next slide. Generally just in 4 parts. The first part is standards that apply to all foods, like nutrition label and labelling and date marking and ingredients, maximum residue levels for contaminants, materials in contact with food, and chemical and micro contaminants. Chapter 2 defines specific foods, meat, fish and alcoholic beverages. Once again, an emphasis on meat pies for some reason. They're very important. Chapter 3 is the food safety standards, one that a lot of VHOs know a lot about, training, temperature, cleanliness in food handlers. And Chapter 4 only applies to Australia. That's primary production standards. It covers things like seafood, poultry, cheeses, wine and dairy. These standards are enforced by state and territories and the New Zealand food agencies, as well as local government and our specific heroes, the environmental health officers. Australian Department of Agriculture and the New Zealand Department of Primary Industries inspects imported food. Anyone can change the Food Standards Code and put in a proposal, or a proposal can be raised by FSANZ itself or the government for a new standard, particularly if there's a public health issue that comes urgent. In making the decision, all the state and territory food ministers meet regularly and they can actually overturn a FSANZ recommendation. And New Zealand as a nation on its own has a right to opt out of a standard if it wants to. So on to the next one. This is my work, risk analysis. At FSANZ, we always used and also at the Food Safety Information Council, we use WHO's risk analysis model, or the two-yolked egg, as we like to call it sometimes. Risk assessment that uses the evidence, not just science, but also social science. So we look at how people read food labels and consumer understanding. Risk management, that's the policy or the actual decision. And surrounded by that is the risk communication, which used to be my line of work, involved in both of those processes, coming up with something that will be workable for the whole of the community. Adding to the risk isn't just the hazard, so it's not just the science, it's a hazard and also any outrage that the consumers have out there. And a bit later on, I'll come to genetically modified food. Obviously, the hazard was well managed, yet the outrage was so high, it totally changed the standard and how it operated. So on to the next one, a risk analysis example. I'm using mercury in fish, a bit unusual. Naturally occurring mercury in some types of fish is a risk particularly to unborn babies. So we had to be particularly careful, and children up to 6 years old. The risk management was to advise women who are pregnant or planning to be pregnant and kids up to 6 should only eat one portion a week of a couple of types of fish and no more than 2 serves of other types of fish. And that was the risk management side of it. The risk communication came in because also the evidence showed that seafood is an important part of our nutrition. You need 2 to 3 serves for good health a week. And in general, Australians and New Zealanders were only eating 1 serve. So we didn't want to put people off fish. So the recommendation was for those high-risk groups to stick to that limit, but there were loads of other fish that they could eat. We put that in our pregnancy advice everywhere. Coming to the next slide. So what does work well in the whole of this system? Certainly, the national food recall systems kick in really quickly. Whenever something does go wrong and there needs to be a food recall, the state or territory where the head office of the food company or the specific food importer is located leads a recall. It's coordinated by FSANZ, and things can be out there and off the shelves really quickly. If there's something more than an everyday recall, a major food incident, then that's coordinated by FSANZ and all the states and territories become involved in that. FSANZ also monitors the food supply for chemicals and contaminants and does testing like the Australian Total Diet Study every few years. That actually tests the food, which is really interesting, as it's eaten. So potatoes that are cooked, apples that have the cores removed. And that consistently finds that there's safe level of contaminants, and often not even contaminants can be traced at all in testing the food. The other thing that works well is a plus and a minus. It's the duopoly of the supermarkets. Coles and Woolies have much of the market, as well as IGA, the independent grocers, who have a smaller share of it. But certainly their systems are very good and food recalls happen really quickly. And certainly Coles and Woolworths, if you want to get your food product on the shelf, it has to completely make sure it's part of the Food Standards Code, particularly with labelling requirements. To the extent that Coles and Woolies also sometimes go further, they do things that the consumers are outraged about. So they remove red food dyes, for example, or list hormone-free meat and things that actually aren't food safety issues, but something that consumers are concerned about. Surveys show Australians and New Zealanders generally trust the food supply, which is good. And as people move into developing their new food products, startup companies, places like farmers markets do a really nice job in providing training, and even professional kitchens, so that startups can get out there and start their food company. There's been some very successful ones that have started like that in Australia. The next slide is what works less well. The enforcement of the food safety standards and the primary production and processing standards in Australia vary from state to state and are different in New Zealand, making it a little bit harder for to work across state boundaries and into New Zealand. Enforcement agencies are overloaded, especially at the local government level, and a big shout out for environmental health officers, who are managing COVID as well as keeping the food safe at the same time. Complexity, once again, a good thing and a bad thing. A third of Australians are born overseas and English may not be their first language. They're more likely to be running smaller retailers and food service. It gives us a great different food supply with some wonderful cuisines, but it's a little bit hard to always make sure that people have material in their own language and know exactly what they're doing. Unskilled workers and those with poor literacy may enter the food service. I know when we were developing food safety standards back in the 90s, we surveyed food outlets, food retailers, and their educational levels. And it was quite funny because most of the owners had very poor educational levels. Most of their staff obviously were arts undergraduates and had university degrees or on their way to getting one. So it's interesting on who makes up these businesses. Startup businesses also may have very little food safety knowledge or understanding. They think they've got a lovely product, but they don't quite know how to produce it safely. It might start from their own kitchen. And what really is undermining the system at the moment is unregulated sales of food made in domestic kitchens on social media like Facebook Marketplace, Weibo and WeChat, which undermines the entire food safety system. We're doing our best to work with Facebook and try and stop this. We put a number of media releases out about that. My local Indian restaurant points out this is really unfair because she has to pay insurance and train her staff and book somewhere, and people are literally cooking stuff in their backyards. So here's some examples of what can go horribly wrong in the food supply chain, showing how we are linked around the world. If stressed businesses get out there, they can do an awful lot of damage. 1999, the Belgian Dioxin PCB contamination. A couple of farm workers thought they'd render some animal fat down in some oil containers, contaminating all the animal feed supply in Belgium. Stopped the Belgian exports for several months while this was all sorted out, and made a huge dent in Belgian exports for a while. We go on with this sort of theme of two blokes thinking they're doing the right thing, but they're doing something really stupid all the way through these, I think. We all know about the Garibaldi Metworth outbreak in 1995. Very tragic, a child died. Several others ended up on dialysis or needed kidney transplants over the years. And that really was the stimulation for the food safety standards in Australia. Very tragic. Once again, a stressed company working before Christmas in the heat with a drought. The animals were stressed. The meat was contaminated. They would backwash, slop some of the fermented meat back into the next batch, and ended up with a really nasty case of food poisoning. 2008, the melamine contamination of milk ingredients imported from China. We also have terrible vision of, babies screaming their heads off because they were very ill because of this contamination. Once again, this was an illegal activity where farmers were not used to having dairy cattle. They weren't in good condition. Their milk was being knocked out for poor protein content, and a couple of blokes again decided they'd stick some melamine. into the product, which made the protein test higher, so it looked better quality than it was, but that was extremely dangerous, especially for babies when it got in infant formula. I worked 3 months on that, dawn to dusk, with people worrying about it. Luckily, the very little was imported into Australia. We didn't import milk products. There were a few sports drinks and some confectionery there. 2010, bonsai milk product, soy milk. The manufacturer moved from using seaweed itself to seaweed powder, which was much more concentrated and very high in iodine. And 500 Australians got seriously ill with thyroid dysfunction. Luckily, the specialist picked up what had happened. In that case, there wasn't much, there was sort of reverse outrage. People loved their bonsai soy milk, and we kept finding that it was being sold under the counter in a lot of coffee shops because it made good coffee for people who didn't want milk products in their coffee. And so that took a lot of crackdown to do that. In 2013, Fonterra, the big New Zealand milk company, a couple of guys thought they found some leftover whey powder from a couple of years ago. Contaminated 1,000 tonnes of powdered milk, infant formula and sports drinks over 7 countries, terribly damaging for the country. Didn't really make anyone too ill, luckily, but a very risky thing to do. Why they thought they wouldn't take the risk and turn that whey powder into animal feed rather than feed it to babies. I really don't know. And raw eggs, my favourite, raw eggs. Why chefs have to use raw eggs, not bottled mayonnaise, I don't know. But the Melbourne Langham Hotel afternoon tea in 2015, 44 people ended up in hospital with egg mayonnaise there. And in 2014 in Canberra, similar one, even worse because it was a Mother's Day lunch. 162 people ended up in hospital with salmonella illness and infection, which literally shut down our 2 hospitals in Canberra. Terribly dangerous. And listeria and rock melons in 2018 caused 7 deaths in all and a miscarriage. And that was caused not so much by a problem with the people who were processing the melons. It was just lots of dust around, and fans blew dust onto the rock melons. So things can go very wrong. Also in our system, occasionally politics, there'll be enough outrage out there, will override the science of the regulators. Pregnancy warnings in alcohol have taken an incredibly long time, were brought in voluntarily, doesn't work. Recently, the food ministers have decided to make it mandatory, but there was a lot of complaint from the industry on that. But it's very dangerous alcohol. It's an aflatoxin and certainly not good for unborn babies and fetal alcohol spectrum disorder. Folic acid fortification, also a similar thing. Adding folic acid to flour, particularly used in bread making, reduces the risk of neural tube defects like spina bifida. It was introduced in Australia, but at the last minute it was pulled in New Zealand. Follow-up evaluation of this has shown a big reduction in neural tube defects in Australia, but not in New Zealand. And that's quite tragic, particularly as they're in Maori groups and the poorer people who can't always afford to take supplements or know about them when they're pregnant. And genetically modified food was also overturned, requiring labelling, even though it had gone through a safety assessment by FSANZ. And that means that only highly processed GM foods like cottonseed oil and canola oil is grown in Australia. And that's because it doesn't have to be labelled as GM. So it's interesting, the few cases there where politics gets more involved. So just on looking at the last bit of the food chain is where I'm currently working, in fact, since 1997, when the Food Safety Information Council was formed. We all got together as government, as industry, as consumer groups and academic groups to try and close that last bit of the food chain, which is between the point of sale until the consumer eats it. We've got a whole range of members, including CSI, Row and Choice. We run Food Safety Week in November at the beginning of the summer, and a summer campaign, as well as monthly campaigns throughout the years. And we have TV and radio, community service announcements in doctors' surgeries, social media, and we do a separate Indigenous campaign run by Indigenous people, which we're quite proud of. The next slide is the statistics. If we look at it, there's 4.1 million cases of food poisoning in Australia, over 30,000 hospitalisations and 86 deaths a year. Big strain on the health system, 1 million visits to doctors, 300,000 prescriptions for antibiotics, and 2.1 million days in lost work a year, costing Australia about 1.25 billion. That's the Australian Government Department of Health report into foodborne illness study found that. So the role of the Food Safety Info Council is to try and reduce that by educating people. We take research, we consult on it, we run Food Safety Week and year-round initiatives. We're a hub for consumer and media inquiries, and we have great value in that we'll take, say, recently we've taken a WA Health what to do in emergencies like power outages and floods and fires, and we've turned that into a national campaign. So there's a lot of value there. Also, as a charity, we get a free run for our radio and TV, so it doesn't cost as much as government's actually advertising. We also conduct consumer research, which is the next slide. And this is where it's worrying about the community and their lack of knowledge about food safety. A study shows that 17% of Australians say they don't wash their hands after going to the toilet. 20% don't wash their hands before handling food. Consistently, men's food safety knowledge is worse than women's. Younger people's knowledge worse than older Australians. University educated people have poorer knowledge than those with a high school education. We're not too sure, but I did see a similar US study that thought that people, perhaps who are more likely to go on to university, didn't do home economics in high school, which is a good point. And we work very closely with home economic teachers to try and get that improved. 35% of Australian households have someone at high risk of food poisoning, including the elderly, pregnant or immunocompromised. 25% of Australians continue to eat raw or only slightly cooked eggs, and 12% eat them often, big risk of food poisoning. And 75% of Aussies don't have a meat thermometer at home. And those 25% who do seem to keep it in the bottom drawer in their kitchen. So our campaigns recently with the general community, we're encouraging everyone to do food safety training. We've done a joint project with Highfield e-learning in Australia to try and get a really easy food safety course going in Australia that's good value, and certainly is one of the best I've seen. We've done coronavirus and food and how it's not a risk, but other things that people need to do. We do death cap mushrooms. We do raw eggs, listeria, hand washing each year. We do annually on Global Hand Washing Day. And we move a little bit away from just consumers and into things that are technically food businesses like school canteens, people doing regular fundraising. We educate on cooking temperatures and how to use your meat thermometer, and fermenting and preserving at home. That was very trendy last year in the lockdown. And raw and risky foods like unpasteurised milk products and bean sprouts and lettuce. Bean sprouts misspelt there, but the only thing food safety people won't eat. So that's a community service ad from last year, which ran on TV. And as you can see from the next slide after that, this is some of the coverage we got, which is very good. In fact, what we did for a very small several $1,000s for this campaign, we did just about everything that people did for the COVID health education campaign, which cost well more than $40 million. So very good value for how we get it out there. We're particularly pleased that videos get played by Tonic Health Media in medical practices and pharmacies over the summer. And certainly the TV coverage and radio is excellent. So just in summary, look, we've got a great system here in Australia. All the way from farm to fork, right through the chain and everyone involved. What we really need to do is get the community better educated in food safety, because young people in particular are the ones that go and work in the food retail industry. And I always make the analogy, it's a bit like wanting to be an Uber driver or a taxi driver, and you don't even have a driver's license. You know, these people go into food handling jobs without even knowing the basics like hand washing. It's great that everyone works together on the stakeholders, and I want to reiterate the point that everyone's made so far, that food safety is everybody's business. And there's our contact details if any of you want to get in touch and get more involved in Food Safety Week and the work that we do. So thanks, guys.
Thanks very much, Lydia. I think we're going to ask you a couple of questions now, but I just wanted to make a comment in relation to the education. I know that in the early 90s in Western Australia, when we developed Food Safe, the education advice at the time about English levels in the food industry were that it should be targeted at about what was grade 7 in WA in those days, about a 12-year-old's education level for English. So I certainly think that has been something that has not changed substantially over time when we're dealing with particularly small retail operators. So the education and the training programs definitely need to be targeted at that sort of level.
We do, and even now we've dropped it lower to a 8-year-old, which is the federal government advice. It will get you through a news-limited newspaper, perhaps, about that level of reading. Sure.
Okay. So there was a couple of questions we were going to ask you. And I'm more than happy to help you out with these, because the first question is, what does an average day look like for a retail food safety inspector?
Yes, and a little bit out of my area. One of the things they're actually reviewing the FSANZ Act at the moment into looking to give them a greater role in a couple of things. One is educational work, which they're not allowed to under their Act very much. And the other one is getting more involved in advising food businesses on how to do the right thing, which they're quite limited in doing at the moment. So the whole system very much relies on food safety inspections, and I'm sure you can probably answer that better than I can, Phil.
Yes, certainly. For myself, I work a lot regionally, so quite often it's anything up to 3 or 4 hours drive to a remote station or something like that to do an inspection and have a look at a water supply and that sort of thing. So it varies a lot. I know in the city it's I do some work for a couple of city local governments, and it tends to be a case of getting out there and talking to people and doing sort of 8 or 10 premises in a day, sometimes more. But yeah, certainly from a retail inspection point of view, I made the comment earlier in one of our chats was that when we were talking to Papua New Guinea and James up there. So it's certainly in situations like that, we certainly see ourselves more as an educator than an enforcement officer, that's for sure.
Yes, no, great believer in that. Yeah, I saw James' bit about being an educator more than a policeman. Very important.
Yeah. So the next question, how do you support retail food establishments to improve their food safety practices?
Yeah, I suppose that came to my point that making sure that the people that go and work in them do have the very basics of food safety knowledge out there and knowing how important it is. It's always disappointing. We did a survey this year comparing with last year's hand washing survey and only found a 3% increase in people washing their hands before handling food. After going to the toilet, which is the most important one in a way. And that's a real worry. And that's after a whole year of really solid COVID-19 education hand washing campaigns, that it hadn't gone up much. Though at the same time, they were cleansing their hands quite a lot. There's a study in the UK that showed people needed to wash or sanitize their hands 8 times a day to reduce the risk of COVID infection. And guys were reporting in the national survey about 11 times they were using sanitizer. But then again, we found outbreaks of norovirus around the country because they're relying on sanitizer, not hand washing, and that doesn't work with noro. So we've had to put a reminder about that out recently.
Yeah, I certainly think there's a little more awareness with things like hand washing as a result of the pandemic. So hopefully that'll flow through into people taking a bit more care when they're handling food. And certainly the other aspects, like you mentioned with training, I think that's one aspect where we've devoted a lot of effort over the last 10 or 20 years to trying to improve education standards in particularly retail food establishments. So I think most local governments around Australia now offer some form of free training to their local food proprietors through the various programs. And you mentioned Highfield, and I know they've been getting into food safety training in Australia, and we've had a couple of programs in Food Safe and On Alert over a fairly lengthy period of time to try and improve that knowledge. So that is something that I think EHOs and local governments are doing to improve the education standards out there.
Yes, and we've been pointing to all the free ones that are available too. You know, we just like people to do anything, basically.
Certainly. Well, I think I've got one more question for you. What inspires you to do the type of work that you do?
It's interesting. Look, I went to Food Standards having run the gun reform campaign for the federal government. That was very interesting, with a few stakeholders that really did want to kill you. And the job at FSANZ, as it was then, came up, and I thought this will be lovely, hang around with gourmet food writers, you know, what can go wrong? But it was fascinating. I have to admit, it's 15 years of my life well spent doing some really interesting stuff on the international arena and changing and training for the WHO in China, doing work in India, doing work in North America, and with colleagues in Europe as well. It was very exciting doing that. Now, I have to admit that the current Food Safety Information Council, because we've lost our federal funding, which is very disappointing, seeing what good work we do, that's pro bono. In fact, all our experts work pro bono on that, and we're always keen for other people to join us. So it's certainly not the money on that, but it's certainly very satisfying work. And it's good to do on top of the consulting I do, where people don't always take notice of what I say, but it's very satisfying working in the food safety area. And look, helping, you know, the EHOs the other day describing in Brisbane, chasing this guy who was selling food on Facebook around Brisbane, until they finally caught up with him at the uni, selling curry out the back of the boot of his car. So it's nice to know that we can try and you know, crack down on that sort of thing too.
Yes, it is becoming increasingly a bit of a nightmare for local government enforcement officers. I'm aware of that. So we can use social media ourselves, I suppose, to try and communicate those messages. All right. It looks like we've got at least one question's come through. Daniel Giffney has asked the question. In New South Wales, we have food safety supervisors in food premises, but it doesn't seem that the information is passed on to all food handlers. Would there be benefit in having it compulsory for all food handlers?
Yeah, that's a really good point, because initially it was meant to be nice and easy. Someone, you know, set up as a supervisor in a food premises, and they, you know, we don't want them to have PhDs in food safety. They just have that good knowledge and do the course and then pass it on. But look, I know from personal experience, when I go in the other day, you know, they were selling creamy cakes on the counter by the till, with everyone sneezing over them in the time of coronavirus and norovirus. I said, can I talk to the food safety supervisor? And they had no idea who that was. You know, I'd be a bit of a fan, perhaps, if people did more complex training, which is why we're getting into encouraging people to do all sorts of different types of training, and using the high field ones as well as the free ones. But the supervisor training is good. I think everyone needs that level of skills. Though at the same time, if you've got a lot of staff, that might be hard, and a lot of them are casual. But our point is, we've gone out to schools and unis and students saying, like, you know, kids in year 12 do things like, you know, the safe handling of alcohol, so they get bar work. It would be great if they also did some food safety training to help them out.
Yeah, I think that's been one of the positives with Food Safe and the I'm Alert as well, is that we've been able to get those things into canteens and into schools and into where students are actually able to do that sort of thing online and get a basic understanding of food safety. Yeah, look, Daniel, in answer to your question, I think it should be all food handlers. I mean, the code basically says that, the Australian Food Standards Code says that a person handling food has to have sufficient training and knowledge of the practices that they're undertaking. And really, basic food handler training should be the absolute minimum, in my view. So I'm not sure if we've got any more questions. No, it's just come up there. No further questions. So, Lydia, thank you so much for your presentation. Today's been a bit of a challenge, and it's going to continue tonight with presentations on the other side of the world with NEHA. So National Environmental Health Association in America has got several speakers organised. We'll record those and they'll be posted so that people don't have to stay up all night to see the presentations. But in relation to your presentation, Lydia, thank you so much for your time. Very much appreciated, and keen to maintain the working relationship we have at the moment with the council. So thank you.
Yeah, thanks, Phil. Much appreciated, and happy World Food Safety Day.
That's it. Thank you.